A vaccine that is already recommended to help prevent shingles may have another surprising benefit. As you can see, joining us right now is Dr. Todd Eller from Social Health. Good to see you.
Good to see you, Eddie.
Happy Friday. Well, the new study found older adults who received the shingles vaccine were less likely to develop dementia over the following years. So that is a significant finding, right?
Is 25% reduction.
And why are 25%? Is that why researchers are paying attention to it?
Absolutely. I mean, the bottom line is this is a vaccine, the shingles vaccine, and in this study, basically, they looked at a high-risk population, 66 years of age or older, who are in skilled nursing facilities, so high risk in an understudied group. And they showed that there was a certain small percentage of patients that received at least one dose of the shingles vaccine versus people who didn't. And in the group that didn't receive the vaccine, 24% went on to develop dementia over a 4-year period. In the group that got at least one dose, it was 18%. So it's an absolute 6% difference, relative risk of 25%. Let's face it, anything we can do to decrease dementia is important.
Because I was going to say, in the scientific world, is that an eye-opener if you see that, right?
Look, I think it's very important. The reason I don't want to say it's an eye-opener, it's definitely an eye-opener, but it's not conclusive because this was an observational study. It wasn't, so what's really needed is one of those randomized controlled trials. But multiple observational studies in the past have showed the same results.
So what are some of the reasons, some of the theories for why the shingles vaccine might be linked to better brain health?
Look, we don't know exactly, but it could be because the virus, the shingles virus, is actually damaging the nerves and the blood vessels that go on to, lead to something that looks like Alzheimer's, right? It may be, the fact of the matter is that the immune system, it's possible when you give a vaccine, you boost the immune system. Maybe the immune system's clearing some of that Alzheimer's type of pathology. We don't know. But the other thing, in prior studies, people who have gotten more than one dose of the shingles vaccine have had even a decreased risk of dementia. And patients who have gotten more than one bout of shingles have had an increased risk of dementia. So there may be something here. I think it's important to study.
So let's look at the bottom line. Is this another reason to make sure you're up to date on your shingles vaccination?
Absolutely. The most important reason, of course, for those who are 50 and older and eligible is to decrease shingles. Why? To decrease that significant pain, marked peripheral neuropathy, some of the worst pain. That's important. But this is another incentive to get it. Even though we're not definitive on it, I think it's just another reason. If you're on the fence, go get it.
Dr. Eller, great to see you.
Good to see you, Eddie.
Take care. Have a great weekend. Maria.